The show Sharing the Caring City, where different members of the collective Urban Femina use the lens of empathy to unpack an urban issue or perspective. Come join them as they radically try to reimagine the caring city.
Hello, welcome once again to Sharing the Caring City. I'm Vivi, and today we have in the studio a super special guest. Her name is Leah, and she's also a member of Urban Femina. And well, I will let her speak to tell you what we're going to talk about this program.
Hi, Vivi. I'm very happy to be here today. So, hello, everyone. Welcome to our radio show today. So, we have prepared a very interesting topic, and I would love to talk with you about it. First of all, I'm Leah. I'm also part of Urban Femina, studying urban studies here in Copenhagen right now. And so stress, depression, and anxiety are largely related to risk factors such as city density and gender, and also external adversities such as COVID-19. And I would like to speak with you today about what is the long-term impact of this crisis on urban residents' mental health. And there are three main questions. First is, in what way has the current health crisis a lasting impact on life in the city? What are the effects of external adversity on our health from a specifically feminist perspective, we as Urban Femina members? And what are urban strategies suitable for positively and sustainable influencing our well-being? So just to start briefly, it's clear that COVID-19 is a public health crisis. And during the next hour, Vivi and I want to focus specifically on the impact of the pandemic on wider health and well-being through a feminist perspective. And in short, how has COVID-19 and this crisis that is so disruptive and brings so many uncertainties with it affect our collectively ability to live healthy and also to live a very fulfilled life? What are the best urban strategies actually to influence also the way we move throughout the city and to stay positive and to stay motivated as well? The measures and all these curfews have proved a psychological shock to millions of people. I mean, you're originally from Mexico City, and I'm originally from Munich, and we have family members everywhere and also friends. And since March 2020, I think, there is just chaos everywhere in a way. And we were at that time in Vienna, and we started our second semester, and we saw our universities closing overnight, and cities throughout the world went into lockdown. And suddenly, we were so, we were not free anymore, right? To move throughout space. And all these urban conditions, like strict measurements such as also wearing masks and being confined to our homes, made something with us. I think it really changed the way we woke up and the way we interacted with our friends and family members. And I think that these urban conditions have a really big impact on our mental health. And when I think of my friends and also family members or colleagues, I feel like that the word stress and anxiety or fatigue are quite relevant.
Yeah, exactly.
And there are all these very wide limitations on our daily lives, the way, as I said, the way we work and the way we think, but also economic uncertainty, and also the difficulties to stay close to friends and families have a tremendous impact. So how did you maybe you can share also your experiences of being in Vienna and being so far away from your own family in Mexico City. What can you think of the first feeling, like being, so far away from home?
Yeah, when the whole thing started with the lockdown, I remember that I was full of uncertainty. Like there was uncertainty everywhere. Like we didn't know what to do exactly. Like I couldn't know like what was the right thing to do. Like I was questioning everything the whole time. So I was living in a flat share in the 16th district in Vienna with another Austrian guy. But in general, he was like a very distant person, very respectful, but very distant. I mean, for what I am used to, like of the warmth of people and people like talking the whole time. This guy like seemed like very distant to me. So I mean, the first days, fortunately, there was a Mexican friend with me, and she was supporting me a lot. I mean, I went to the supermarket and I saw like the pure chaos of people wanting to buy everything, and suddenly like things were run out, such as, I don't know, eggs, no? And this friend like really helped me a lot because I was like about to panic, and she was there like telling me, no, like, okay, but there are no eggs, but look, like there are a lot of things. She was like very strategic with me. And she stayed with me like for 3 days during the beginning of the lockdown. And then I went with her to the train station because she had to go back to Ljubljana where she was living. And then really when I let her, when she took the train, my hands, like I was with my empty hands. And then I started walking and like tried to find my own way. And yeah, I felt lost because in some point, like I felt that I have lost my center, and also from being in another city. Like it's really important to pay attention on how the mental effects and the mental state really, like, is really different from city dwellers in comparison, I don't know, like to a more laconic scenario, or maybe also like within cities. And even in the cities, of course, like we are all different persons and we are all constrained by different resources. We live in different spaces. We count with different economic and intellectual and whatever positions. So yeah, I was like trying to be aware, like how would I feel if I was in my home city with my family, with my friends, in my known environment? Because also it was the first time that I was in Vienna, and I had been there like for 3 weeks. So of course, like one of the challenges within the master's program is like to get to find ourselves within the city and to find our own way and to get used to the things, from how to get the public transportation, like to where is the best coffee shop in town to go to drink a coffee or to study. So yeah, I couldn't feel that I was already settled down in Vienna. And then one day after I was alone, I just felt like I wrote something about it, and I just felt like the same symptoms that they say that COVID has, such as difficult of breathing, headache, oppression in my chest. So I was like, this is anxiety, and
horrible.
yeah, we have COVID out there, and COVID, it's like taking the whole conversation, but like we also have these mental issues that are very important to talk about and to tackle in some ways. So yeah, I was really homesick. I was like desperately needed for the feeling of home, of being in a known place for me, in a familiar place. And then, well, I just took a moment like to think to think about what was going on, to put the things in perspective. And then I realized that the only familiar thing that I counted was myself, no? So the only certainty that I had was myself, and I had me like to cope with everything. So that's, I mean, I've been going through ups and downs, I guess, like as everyone. But in the end, I like this is like my strongest strategy to cope with this situation and to with every situation. I mean, like this is something that I realize that I can apply in different problems throughout my life. So yeah, really recommendable, like to really take a break and to put things in perspective and to get to realize that we count with ourselves. But as we were talking on and on, I mean, like at least I know that I'm capable of doing this because I have a lot of certainties, economic certainties, that basically is one of the most important ones to feel safe, to feel comfortable. So, but we wonder over and over what happens with people that don't count with economical means, that don't count with a proper space to live. No, because
Absolutely.
I had a room. So
yeah. So when I think of this time, suddenly what you said is things are getting like more important, you know, like and suddenly also less important. So you're at home and you can't go out. You can't, like, you have to be at home, and it makes something with you. This, like, suddenly you're just not free in the way you can move. And what you told me, you know, we had, like, every one of us had totally different memories of it, I think. And we were really lucky to be in a room, in a safe space, like be somewhere where we at least maybe felt lonely and also sometimes very depressed, or sometimes like scared, and this uncertainty of how long will that last, you know, and when can I see my family again or my friends. But we had this safe space. And then it was also, I think, about creativity. What do you do with your time, right? How do you cope with the moments of, like, when you suddenly, when you can't sleep properly, or you wake up and you feel very tired, even though you slept maybe for 8 hours, or you this, like, stress, I think that is definitely also a big issue in today's world, I guess, like in just the way we, like, the way cities are built also today. You know, it's just like so complex. And taking public transportation, going from A to B, being stuck in traffic. So I think stress in cities is a big theme. And with the pandemic, we definitely have to think about how we can rethink also the way we deal with stress in cities, right? And when I think of you know, like, your experiences, my experiences, all these different experiences, I would love to talk with you about the idea of, did you ever think about therapy in cities? So, because when I think of all our friends and colleagues in Urban Femina, the majority of us is actually seeing a therapy on a regular basis, right? Exactly. And do you think that maybe there is a need to think about oneself more than ever because of the pandemic?
Yeah, for sure.
You know,
I mean, I think as we were talking the whole time, like, it's really important to talk about our feelings, about what's going on. And of course, like, if you have the chance to talk about it with a professional, like, it's the best thing to do, no? But of course, like, we come to the same topic of who can afford a therapy, who has the means to access to a therapist. But also, like, we've been building these support networks within each other. So again, like, there are opportunities, there are chances always to improve the mental health and to talk about this. And we are very aware that these support networks are really present in female relationships. But what about men? How do they talk about their feelings? Do they even do so? So before we go on with the conversation, I would like to ask you, like, how were your feelings at the beginning of the lockdown, and if you can compare with how you're feeling right now, how are you dealing with this situation? And I would like to make a pause to introduce one more time our playlist prepared by one of our colleagues, Sarita. She has a special selection of electronic music, but we're starting a bit with R&B and soul from an English artist called Cleo Soul. Her mom is half Serbian and half Spanish, and her dad is from Jamaica. And I chose this song with Sarita because it's really beautiful. It talks about how Cleo Soul says that she had to grow a rose in the dark. So maybe that's something that we're all doing now, despite the COVID. Like, despite, like, no matter how dark the situation might seem, we have to grow beautiful things. So let's listen to this song.
So we're back. Vivi, I would love to speak with you about our next theme, which is the question about what are the effects of external adversity on our health from a specifically feministic or feminist perspective. But to start with, there is one term that is a very kind of a buzzword, like very smart buzzword. And the word is resilience. And you hear it everywhere and you read it everywhere. And this term originally derives from psychology. And it is increasingly used also now in the urban context. And resiliency, for the people that have never heard maybe about resilience, it is the process of adapting well in the face of adversity, but also trauma and threats, strategies, and as well like sources of stress. And especially in the recent years in medicine, psychology, and sociology, the term has collectively focused on like short-term but also long-term consequences of stress, and also extreme stress, and there is a difference between you can have like positive stress on daily, like daily life, that can also boost, your energy level in a way. But then there is this extreme form of stress where you really, where you can't sleep suddenly. And I think this kind of stress, extreme stress, suddenly became reality for a lot of people. And for you and me, we're both urban researchers. The current pandemic has definitely pushed us to like rethink also the way we want to plan cities in the future, have to plan cities, and also how we can create resilient spaces for future threats, spaces which are prepared for future shocks. So going back to the initial idea or question of what are the effects of external adversities, when we think of the city as a complex entity, we also have to bear in mind that people have very different needs, right? Like different needs and different, different fantasies and also different routines when it comes to the access to the city. And what do you think when we think of man and women? I think our cities today are built also for the neutral male user, and there, like a lot of cities, neglect the needs and interests and routines of women and girls, girls in the city. So do you think that there was a big difference of how women perceived stress and during the lockdown, and how women maybe were coping with stress, being at home with children, working at the same time, having a relationship, maybe also like a very difficult relationship, or like being alone, not being in a relationship, not having a partner that is supporting them. So what do you think?
Yeah, for sure. Actually, I was reading some statistics of the British Office of National Statistics, and they said that in the emergency line, they received more calls of women, and they know that it happens because women got into more stress, more anxiety, more depression, because they are the ones with the least access to economical resources, or maybe they are pressured because they have to pay a rent because they don't own a house. So, of course, for sure, I do believe that there is still like a gender gap between like who suffers more within this COVID lockdown and the consequences of unemployment and the lack of access to urban spaces, even like to go and relax. So yeah, for sure, I do think that there is a gender gap. And actually, I was also reading another Spanish research about how families are also super affected. Like within our narrative and our pursuit for the caring city, it's also like families were neglected during the pandemic. Like the whole focus of the situation was put into businesses and bars and everything, like in an economical sense. That of course it's really important, because of course you have a lot of families that are supported by, I don't know, by bars or by restaurants, local commerce, and they were also left apart. But how many times did we hear about strategies for families with children?
Absolutely.
Or
like
single
4 children,
mothers?
5 children, what do? You suddenly have your children at home and you have to cope with so many different things. And also what I think is like the separation of spaces suddenly, you don't have just like, you go to work, you leave your home in the morning, and then you come back and you have this like private public sphere suddenly interlinked, and there is like a fusion of both spaces in a way. And suddenly, how do you manage everything that is happening at home and still preserving your own space to work, but then also being there for your children. So I was thinking also about the different care responsibilities between women and men. And do you see a difference? Do you see, I don't know, maybe from like talking with friends and also maybe with family members, who has the care responsibility at home? And do you think that the responsibility may also shift or has shifted the way women want to deal with this situation? Maybe there is also a change happening right now, because
in the end I think that the responsibility should be shared, but in the end we are repeating the patterns that were inherited by the former generations. And also it's not only a responsibility of the parents or of the family, no. Also I was reading that a lot of Spanish families they also relied on grandparents to take care of the children, and with the pandemics, of course, they didn't want to get in touch with them because they wanted to protect them, because of course they were the most vulnerable population in the first wave of COVID. So it's also a responsibility of the state. It should be also a collective responsibility that we aim, of course, in the caring city perspective. So and also like let's not forget about how men are feeling in this situation, how maybe for them it's more difficult, and because it's also a pattern that is present even before COVID, that maybe they don't express their feelings so much, they don't talk so much about their feelings. So I would like to talk with this further. What do you think if we present the next song that we have in the queue?
Absolutely. I'm happy to announce the second song. It's called Sound System by a very talented Canadian, Pascal Project. And have a look and listen. I'm happy to go back in a second.
Sorry, we had to stop the song because it was too long. Welcome back.
Welcome back, everyone. We're starting with the third kind of theme, the question: what urban strategies are suitable for positively and sustainable influencing our well-being? The experience of life under lockdown and social distancing has stimulated new behaviors, which have the potential to accelerate positive trends towards a more environmentally sustainable and better way of life, maybe. And I think we really need innovative solutions right now. It's about really thinking of solutions that cater for everyone, and that when we think of public spaces, when we think of what was important for you in the time of lockdown. I mean, we were not supposed to go out, but we could go for a little walk and we could enjoy the air and just listen to some birds and see trees outside. And I think we really need to think about new ways of how do we think and plan cities and how important public spaces are for us, because suddenly, as we said before, we are at home and we can be lucky, or some of us are very lucky to have a safe place. And but also the outside world is important. Where can we actually meet? Where can we still get in contact with other people and interact? And it's very hard. We're in Copenhagen right now and everything closes at 10. I mean, again, we're also lucky here because in Spain and in France and in Germany, there is lockdown again. So people are not supposed to leave home after 8 or even before. But still, where are these like spaces of encounter? Where can we meet? Where can we interact? Because that has a big impact on our well-being, right? Being somewhere where you feel comfortable. And then again, also where you feel safe. How and what do you think, like, how can women also contribute in planning and designing cities in accordance to the need of women and also of the need of a better well-being?
Yeah. Well, like according to this feminist perspective, like let's not forget that it also strives for the need of having the proximity city of how we can develop our lives and cover our basic needs with the local commerces or with the local services that are in our own neighborhood. So I was listening a lot of people that were saying how local commerce saved their lives within the pandemics, because of course, like, I don't know, in Madrid, for instance, they couldn't like be far away than 1 kilometer from their places. So of course they survived with that. So maybe also looking to this proximity city might be a good strategy for the future urban planning, and in order also to recover the community bond, like to really like need it again in some way. And also, I mean, with a lot of things, I think that also COVID shed light on the need of public space, of urban green spaces as well, how they are super important for our mental health. I remember a friend of mine that lives in Mexico, in my neighborhood, in Mexico City. He told me that he was aware that there is a lack of urban green spaces there, but he developed his own strategies. He was like, okay, I'm going to go with my bicycle, because he's a cyclist in the city. Like, it's kind of possible to be a cyclist there. And he told me, like, I'm going to take my bicycle and I'm going to cycle to this park that it's like 5 kilometers away from our neighborhood. And I'm going to go there when no one is there. So also, like, I mean, imagine that instead of selecting a very specific time frame to go there, that you can do, like, you can go there whenever you want, because it's open, it's free, it's safe, it's enough for all the population, But having a city of 23 million people only with
another dimension.
only with less than 5 square meters of green areas per inhabitant, it's like, I mean, it's not enough, no?
And it's another reality, of course. We are here in Copenhagen. Everyone is on a bicycle, and it's definitely another, other needs are important, of course, there. And talking about the 15-minute city, I think that this idea of being able to get everything that you need in a very close, very close from you, has definitely a positive impact, because suddenly you don't need to go and take a bus for half an hour to get your groceries done.
Exactly.
This proximity also gives you again this idea of real interaction, of talking to your neighbor and being part of a community that is taking care of you, and where you have physical contact. I mean, physical contact maybe with masks now. We do have still the reality of a global pandemic, so we need to bear that in mind. But again, talking about stress and anxiety, how can we reinforce these values? How can we reinforce the idea of having actual conversations? And when we think of, all these like crazy Zoom calls and these like, and FaceTime, of course, it's a revolution in that sense, that we can talk, virtually or digitally and have these conversations with people and also your family members that are in Mexico City now. But at the same time, there are also people like elderly people and people that are not so comfortable with like all these technical devices. How do they cope now with this complexity of still like staying in contact with people, communicating with people, so what do you think? How important is communication now?
Well, I think that as always, communication is vital, and I mean, you make me think about the elderly with this question, no? Like, I remind like the grandmother of my boyfriend. They live in Vienna. They are from Vienna, and she had to be alone because like we wanted to protect her while we were in Vienna during the lockdown from seeing us, because of course we know that we were at risk to go visiting her. So my boyfriend would have phone calls with her, or maybe we would also visit her, but like only in the courtyard of her building, like never like a face-to-face contact or communication, because of course we didn't want to be a risk. So yeah, like it's very important like to tackle the strategies from the built environment, but also like to the idea of bringing welfare to people, also like to pay attention to the social housing, because of course you have a lot of families living in an apartment sharing with another families, and maybe like they have to sort out what they're going to eat in the evening, no? So it's also a matter of that, how also the economical situation can cause a lot of stress, and more with these pandemics. And we come again with the same topic of there is how many spaces do we have also to talk about our mental health, about our feelings, about our worries, no?
Yeah, and is it socially acceptable? Is it accepted to speak about your emotions, to have spaces where you feel comfortable and also safe to speak about it? We are here now speaking about all these things, but in some also relationships or families, you can speak about that openly. And these safe spaces, if your safe space is not at home, where is the safe space outside? And what is necessary for our built environment, for public spaces, that people feel safe, also maybe to meet and chat outside, not feeling surveyed or not feeling, or maybe not being heard by anyone, but still having these like hubs where you can stay outside and speak and chat and interact with people.
You were talking about these innovative strategies, but I would like to think about them I like to think about them as a back to the basics, you know, because like the thing that has always existed is the community,
Absolutely.
your local community in your neighborhood, or traveling by bicycle. Like how many years has the bicycle has existed? Like 200 years. So in the end, those are the basics that saved our lives and were very innovative in their time, but that now we have to come back to them, no? And also to again pay attention to the specificities, to intersectionality, no? Like who can afford I don't know, to live in a flat that is near to a supermarket so they can use the bicycle, no? And so it has to be a very holistic approach. And talking about the urban green space, I think that there is nothing more holistic than that, or the bicycle, because like if you ride a bicycle and you don't pollute, you are keeping yourself fit. You are also like there are a lot of positive emotions and energy that come to you when you are cycling, no?
Yeah, it's a circle, circular, like being in the nature and getting fresh air and moving around and just being in motion. And So when I think of cities, and that cities get more and more dense and polluted, and these spaces where you can kind of escape and are getting more important. And I think of these little also tactical, like, you know, urbanism, like new interventions that were taking place everywhere, where suddenly you had like new bicycle lanes and new spaces that were just evolving around the city. So crises also bring up like new, you know, solutions, new ways of thinking, being creative out of a crisis, right?
Yeah,
so
sure.
we definitely have to like stay positive in that sense. And I think
that maybe we can go to our next song,
and then
no?
we can end with our last topic.
Okay, we want to introduce you to Yaeji. She's a Korean American artist, and this song is Rain Girl. Sarita, our Urban Femina colleague, she discovered this song 3 years ago, and yeah, that's why she like wants you to listen.
What I just thought is that I really miss dancing. Actually, I do miss music and dancing, and I think dancing is also really important for our health.
I can relate.
Right?
For mental health and physical health.
So our last topic will be what is positive actually today in our really like our crazy world and very stressful world. When I think of our generation, I of course have to think about Greta Thunberg and you know, the relationship between nature in relation to stress and anxiety. And COVID, or the pandemic, is not only about COVID-19, about the virus itself. Of course, it's about the mental health, as we said, and about anxiety and about, the inner complexities that we face as human beings. Do you think that we have detached ourselves from nature?
Yeah, for sure. As we were talking, like the pandemic of COVID was caused because more and more the humans are invading the nature environments. But also, like I also believe that since we are taking a lot of distance from the nature, like we are having all these mental problems. No, that I mean, it's not that not necessarily that they are like problems that we like. Talk about them as bad, but like on the contrary, we need to talk about them more and more in order to understand what's going on and to try to detach ourselves from that daily pressure, no, of having anxiety or depression about like these uncertainties, no, like every time we are bombed with messages that generate anxiety, like COVID was also the spread of fear in the end. Like
of course,
I read a lot of stories of people that said like the only thing that we read were news and news about dead people, and in the end we also have more problems. I was reading in this Spread Stories Not the Virus project that you collaborated in, a Peruvian girl. She was saying like in Peru we have femicides and we have people dying from hunger every day, but of course that is those things are not in the news. And then we have like, why do we have to know all the time of how many people died from COVID? And we also have other important issues. So like those things, like I believe that there is also like some framing in order to keep this fear, in the people that are reading the news. By the way, I would like to say hi to my friend Nat Pebo. Thanks for listening to us. You're there in the chat.
We're happy that you're listening. Talking about nature, talking about maybe also circular systems, like thinking of animals, thinking of how we treat animals, thinking of how we treat our environment, the way also children are educated. Do you think that there is a big change happening now? Do you think that COVID-19 is also, we only talk about the virus and death and anxieties, which is good, and that is linked with the idea of how do we treat our environment, and also politicians, they speak about COVID-19 and the fear and all these new curfews, but do we really, talk about the source of the problem? Do we really talk about why and how has this pandemic, what is the source of the pandemic? Talking about Wuhan and China and all these markets, and going back to the idea how do we treat animals? And do you think that there is a change happening? Do you think that people are understanding the bigger picture of this pandemic, also related to the idea how we should shape, our built environment in the future, how we should, educate also urban researchers and urban thinkers and architects and planners to think the city of the future, because it's also city as a urban place, but how can we integrate nature in these urban spaces?
Yeah, I think that there are some people that are thinking about that, but again, like those are the same ones, no? The people that are related with the discipline, with the urban studies, or rather architects, or maybe politicians. But I think that they are thinking in the topic more like in a very political way of gaining or not followers, no? So in the end, I would aim for normal people to engage with this, no, to observe the big picture. But of course that requires like time, it requires like information that we like, reliable information in the end. So yeah, I mean, I was reading the other day a UN document about recommendations, and again, like they already know, and we already know, that having nature in the city and green spaces is good for the mental health, and it's one of their recommendations. But again, like what are the challenges, no, of like that we have to take into account to walk towards greener cities or everything. But the thing what I like is that we somehow like start giving like small steps, no, and start talking about this, like in cities, like fostering these spaces for talk about mental health, and for like these spaces of sorority, that not only women talk about this importance of taking care, but also men and everyone, children, the elderly. I mean, how can we communicate this to children? No, that's a big challenge. Maybe it sounds kind of difficult, but it has to be done,
Yeah, because it's the things that we talk about are of course also linked with values, with values of care and also sensitivity and also empathy. How do you bring people, how do you talk with people about empathy? Because this is a part, you have to feel human beings, right? You have to feel what are the needs of people. You have to get engaged with people, not only on this, what you said, political level, but really participate, let other people be part of this wider discussion of how should we shape these cities of the future, and not only of the future, but of the city of now, right? Yeah. Because it's happening right now, here and now. And because when we talked earlier about men and women, for us, it's, I think, also not only generally speaking, but yeah, I think we are more likely to speak about emotions, to be open with our friends, with our female friends, talk about what's going on, in relationships, but also, how has your day been and so on. I think that's really important, and we should like speak about that as well, and bring that also to the male in that sense. Whatever sphere, I don't know, male sphere. Like, I mean, be open about it.
It's not that I want to speak for men, because of course, like we, like from like feminists, like we don't like men like occupying our spaces. But for what I can tell from the testimonies of my male friends, they tell like it seems that maybe they are not talking too much about what they feel, and they are aware that is a thing that happens like in male groups. For instance, the other day I was watching a documentary with a friend of mine. He is from Spain, and it was a documentary about a family that was separated after the civil war. And now they interview the people like when they were children. Now they are old, and they interview them, and they were 2 men and 2 women. So it happened to be that the women talked about the experience in a very like strong and resilient way, But men, when they were interviewed, and my friend said it very well, when they touched like sensitive
Yeah.
spaces and fibers, they started crying, like their voices start to get weak. So it's again like, maybe, I don't know, like we were reflecting on, maybe women were stronger because they have the chance like to let the feeling go out, while in the other side, maybe men didn't. They didn't have the chance to talk about that because it wasn't expected from them,
and also trained not to speak about emotions. For us, it's totally normal to speak about therapy openly, I think, with female friends. And of course, we give birth to children, right? I mean, not yet, but maybe one day. And it's again about empathy, and we have to communicate also in another way, because children don't speak, a language in the beginning, in the first years. So it is about interaction and about facial expressions and gestures and different ways of communicating, which enforce, of course, the idea of communicating on another level that is linked to care and love and so do we still have time? Not really, right?
No.
So much to talk about.
Yeah, but we would really like you to stay with these questions and reflections, and if you have something to say, you can always follow us in our social media, Urban Femina, and please also follow T-Radio in their social accounts, and stay tuned in for the next show, How to Dane.
Next Sunday. Happy to welcome you back and have a great start into a new week.
So we'll leave you with the Black Madonna with the song Stay. Have a nice